The date is February 9th, 2021. I'm just going to do a quick video about the stats in the care homes related to the COVID-19 deaths, supposedly, and not the vaccine, of course. This is a story from The Guardian, and it says COVID-related deaths have jumped 46% in England. This story is from the 19th of January. Considering we are now at around 32,000 deaths, it's going up at a skyrocketing pace. And this should be put through on the mainstream media about the vaccines rolled out through the care homes and the increase in deaths in the care homes. But it's the mutant strain. It was a coincidence that the mutant strain came out just before the release of the vaccine, just to cover yourself, because you know that the deaths are going to go up in the care homes. And if you're getting a COVID jab and you're still dying from COVID-19, you just have to blame the mutant strain. You also put out there a 3-week grace period for the vaccine to kick in. So if you get COVID-19 within the 3 weeks, think about it for a wee minute. So if you get COVID-19, a couple of days, you'll be sick, and 10 days is all you need to isolate, and then you can go back to work. But you need 3 weeks for the vaccine to work. Here is an interesting story also from The Guardian. It says that over 6,000 deaths from care home residents after they were admitted to hospital. So that's quite an interesting thing. Does that mean that they're sending care home patients to the hospitals? Are they registered as care home deaths or hospital deaths? So this story from The Guardian sort of confirms what the other story said. 13 of 27 residents of Edendale Lodge Care Home in East Sussex died from COVID, but several of them died in hospital, meaning that until now they would not have been counted as care home deaths. Since the vaccine has been rolled out from the 10th of December, the number of deaths from care homes have been going up and up and up at a high rate. You're talking from 2 to 300 in December to the beginning of January, 600, and a week later to 1,200, another week later to 2,400 by February. So these numbers have been rising at a steady pace. And sure, the mutant strain came along at the right time. But can we actually honestly believe that the vaccine has not affected the deaths in these care homes, and it's just a new strain of COVID? This is quite an interesting chart here, coming from the Office of National Stats. As you can see here, care home, 1,300 deaths, 15th of January, so this is maybe 3 weeks ago. 23,000 altogether back then, so that might be a few weeks before that for that stat. But it says here that hospice has 1,300 deaths. So why are we counting hospice deaths in the COVID stats? That doesn't really make any sense. There's another stat there also, private homes. It's going up 10% in 1 week. So basically, the death rate is higher than ever, and this magical vaccine is doing a great job. It's somehow making things worse, and the stats prove it. And the vaccine is still being rolled out, and it's obviously that the deaths are going up. Care homes are going crazy numbers. And as you can see, London here is a stat here that most of the deaths are in London. So the official number now coming from the UK government of vaccines delivered to our elderly and our care home residents and healthcare staff is 12 million people. So that's nearly 1 in 5 people in the UK have a vaccine. So Boris is gambling with our lives as a vaccine second dose crisis is not delivered. And people are dying after the first vaccine. Not from the vaccine, of course, but from not getting the second vaccine in time. The number for people that have received both jabs is like 500,000. So now they're saying that the first jab is not effective, and that the doctors are saying that because you're not getting the second jab, it could lead to thousands of excess deaths. To me, it seems like they're trying to get everybody ready, and the excuses are coming thick and thin. We'll blame the longer time wait than the recommended time. We'll blame this. We'll blame the new variant. We'll blame everything. But we won't blame the vaccine for any deaths. So let me get this straight. So if you test positive for coronavirus and die within 28 days, like say in a hospice, you're a coronavirus death. But yet you take the vaccine and die within 1 day of the vaccine. Of course, it's not a vaccine death. It's a coronavirus death. Brilliant.